The rules vary from place to place, but reopening is the common theme. So how should we be adapting in our daily lives? And what will a return to normal even look like? Joining me now is Dr. Peter Uni, Director of the Ontario COVID-19 Science Table, and Dr. Alexander Wong, Infectious Disease Specialist from Regina. Thanks for joining us here.
Thanks, Asha.
Dr. Uni, let's start with you. Will we ever get back to pre-pandemic, let's call it the 2019 normal?
Yes, we will, but not right now. It's important to understand that before Delta, there was a fair chance to get back to something which looked quite normal already, in the next few weeks or months. With Delta now, there's an additional bump, and we just need to adapt to it.
And, with vaccination rates on the rise and restrictions lifting, can people start adjusting their behaviors? There's a lot of questions as to what we can do, what we shouldn't do. Dr. Wong, what do you think?
Yeah, I think it's dependent from one community to the next. I think, Canada is not a homogeneous place. There's a lot of different dynamics going on. So I think it's going to be dependent on, what the rates of Delta and your case rates look like in a given community, as well as what your vaccine uptake looks like as well. So here in Saskatchewan and in our neighboring Alberta, things have opened up pretty much completely. Our vaccine uptake has been reasonable, but we're still lagging behind the rest of Canada. So, depending on your risk tolerance, there may be a role, to consider continuing to be cautious, as well as considering, simple measures like continuing to mask in indoor public spaces, and to consider sort of continuing to kind of restrict gathering sizes and so forth for a little while longer until we get a better sense of what Delta is going to do in Canada.
And Dr. Wong, we often hear about restricting capacity in buildings, but what about restricting the raw number of people we see? Is it okay to see, say, 100 people one at a time instead of all at once in one place?
I think it's less about numbers and more about how you interact with people. So obviously, when you are able to distance, regardless of whether you're indoors or outdoors, that's going to make a big difference. Meeting people outdoors is going to make a huge difference versus being indoors. And so, the highest risk setting remains, meeting people unmasked, in crowded indoor public spaces. Those are the types of settings where, again, if you're fully vaccinated and you're going to be with other fully vaccinated people, your risk is low. You probably don't need to mask in that setting. But if you're going to be, in a big crowd with a lot of different people, you don't necessarily know who's been vaccinated, who hasn't been, then that may be a place where it might make sense, to mask and be more cautious.
And Dr. Uni, there's a lot of questions around what it will look like when people return to work. That seems to be coming up. What do you suggest?
Well, look, right now with our stubbornly stable Delta here in Ontario, and this is different in Saskatchewan, for example, we just need to continue to be careful. This means, you will need to ask the questions, are you fully vaccinated or not? This will play a role. And you need to look into how well is the place you're working in ventilated. And in many situations, there will still be the necessity for masks. That's really, really important just to understand. If we just would go back to completely normal right now, we could be in trouble very soon. If you want a proof of concept, go to the UK, the Netherlands, Spain, Portugal, you name it.
And we know that other provinces have lifted their mandatory mask restrictions and requirements. Dr. Uni, how quickly should Ontario be following suit, you think?
I think we now need to calibrate our reopening to the situation we find in a few weeks. So when we go to the next step of the reopening, we need to wait roughly 3 weeks to see what will be happening. And we need to be careful. If this had been alpha, all done. We go back to something which looks quite normal. With this one, it's much, much more important just to stay careful.
And Dr. Wong, things are reopening where you are, but what advice do you have for parents? I think of myself, I have a 3-year-old who can't get vaccinated. What should parents like myself, 12 and under, they can't get the shot, what should they do?
I think the advice is similar. I think, again, a huge part of it depends on your own personal level of risk tolerance, as well as whether or not you've been vaccinated, whether everyone in the household has been vaccinated. So again, I mean, that's the first most important piece, as Dr. Uni mentioned, is that everyone in the house who's eligible to be vaccinated definitely needs to get fully vaccinated. That's the key point. And then from there, again, I think taking, precautions depending on what your case rates look like in a given setting, and if you're going to be in a higher risk setting, for example, in a crowded indoor setting or even a crowded outdoor setting like the football game, for example, it might make sense, again, in those types of situations to wear a mask and just take some extra precautions as we kind of give ourselves a few extra weeks, hopefully to get more people vaccinated and get a better sense of what Delta is really going to do to us.
Sound advice. Appreciate this. Thank you, Dr. Uni, Dr. Wong.
Thanks a lot.